if there was a way you could save up to thousands of dollars every year. Dental restorative work is one of the most out-of-pocket expenses that most individuals run into every year. The most common dental restorations can include a filling, which can average about $100 per tooth, and a tooth crown can cost around $1,000 for the cheapest material used. Even with insurance, each person having these procedures done will have to pay some percentage of the cost. So how can we prevent these procedures? Community water fluoridation. Fluoride is a naturally occurring mineral in all water supplies, but at a minimal level, it is not enough to reap in the full benefits fluoride has to offer. Water fluoridation involves adding an additional fluoride into the community water supply to reach an optimal level of 0.7 ppm. This is the level that the American Dental Association has recommended for all community water supplies, which is then monitored by the EPA or Environmental Protection Agency to keep the level at a safe level for all of society to benefit from. By fluoridating community water supplies, we can increase the benefits of fluoride, act on its preventative characteristics, and is cost effective. My hopes are that by the end of this speech, each one of you will support my statement that community water fluoridation should be incorporated into all community water systems. First, let's look at the benefits of fluoride. By adding an additional fluoride into the water systems, it would reach all the people in the community and is acceptable for all ages, ranging from infancy to the elderly. According to the ADA, community water fluoridation is the best way to deliver fluoride to all age groups of the community, regardless of age, education, income level, and routine dental visits. This being said, each person would be able to mindlessly improve their oral health in a simplistic way. So how can this improve our oral health? Fluoride helps promote strong teeth and bones. Our tooth enamel is one of the strongest tissues in our bodies, and we would want to prevent it as it houses many nerves and blood supplies. Fluoride also encourages and enhances remineralization, or a natural restorative process of mineral elements in the tooth enamel. During childhood, our baby teeth and adult teeth are forming, and fluoride will help promote strong teeth from the start. By taking care of our teeth at a young age, we would create a longevity of strong teeth for decades after. One issue that does come up from time to time is the fluorosis risk from fluoride. Fluorosis can happen with long-term ingestion of high levels of fluoride, which can show up as little brown spots on the teeth. Again, this risk is from high levels of fluoride. The EPA monitors all fluoridated water systems so that they stay at an optimal safety level of 0.7 ppm. To compare the fluoride levels, the average fluoridated toothpaste has a low concentration of 250 ppm. So as you can see, 0.7 is a minimal level because when incorporated into the water system, the average person drinks 8 cups of water per day, therefore creating a safely ingested dose that minimizes a fluorosis risk. By fluoridating the water systems, this then brings me to my next point and how community water fluoridation is preventative. So I ask the question, who here has ever had a cavity? You know, when the dentist takes this instrument and jams it right into your tooth and all you can feel is that excruciating pain running through your body. Well, community water fluoridation helps prevent and decrease the risk of cavities. The average American diet involves the combination of sugar and carb sources. When they are consumed, the combination with saliva produces an acid that attacks the tooth enamel and causes demineralization or destruction of tooth enamel. Throughout the day, many of us snack and drink sugary beverages, and each time, more acid attacks happen without us really thinking about it. Fluoride has antimicrobial properties which inhibit the formation of bacteria that demineralize tooth enamel. By fluoridating the community water systems, we can incorporate the use of fluoride more during the day, and frequency of ingesting fluoride can ensure that less demineralization and a decreased risk of caries. A research article in 2016 by the CDC looked at the evidence between community water fluoridation and cavities risk over the past 70 years. What they have concluded was by implementing water fluoridation into the community's water supplies, it has reduced cavities risk by 25% in both children and adults. Cavities can be painful, and preventing them with community water fluoridation is the simplest way. This brings me to my last and final advantage of community water fluoridation, which is that it is cost effective. Community water fluoridation has shown to save money for both families and in the healthcare system. Dental-related pain can often be severe and result in a doctor visit, taking more time and money out of your pocket. Incorporating fluoridated water into each community's water system, every person can benefit in the aspect of saving money in the long run, not having to run to the ER or the on-call dentist for a non-routine out-of-pocket exam. A community water system is expensed by the community they live in, and by adding fluoride into the water system, each household would be making a valuable investment into their own health status. For every dollar that is invested in fluoridating the community's water supply, it saves the average person about $38 in dental costs. The 88 states, the average lifetime cost per person to fluoridate a water supply is less than the cost of one dental filling. Like we talked about in the beginning, the average cost of a filling is $100. That puts a very minuscule amount into investing into community's water fluoridation, less than $1 a day. There's a saying out there that says you have to buy some to save some. And I think this saying applies to community water fluoridation. This has been a trending topic for some time now. There has been discussions about the advantages and disadvantages of fluoride. But with the regulations that have been placed on adding additional fluoride to water systems by the EPA, I can assure you that water fluoridation is safe and effective. Fluoride, as we talked about, has many benefits for all ages regardless of their socioeconomic status by promoting strong teeth and preventing the risk of cavities. I hope investing $1 in fluoridating your community's water system sounds much better than spending the time and money in a dental chair for a filling that could have been easily prevented. The CDC hopes that by year 2020, the nation will reach 80% of Americans who have access to fluoridated water, which is 5% more than the nation had in 2012. With your support, the nation will, without a doubt, reach this goal. Thank you.